To you. Currently, there is one mental health counselor per every 1,300 students in South Carolina, according to DHHS. Efforts are underway to improve this now that the problem has been clearly identified at the behest of the governor. But how will you be proactive and innovative in how children receive the mental health counseling that they need?
Well, I was so glad that the governor requested that audit and highlighted the program because it really is an urgent situation here in South Carolina. The recommendations that the governor and the director of DHHS have come out with are really great. We have got to make parity for payment. We realized that different providers were being paid in different ways, and so we've got to create parity to get the most possible personnel into our schools to help support our students and our teachers in their mental health needs. There's no question about it. I think another important aspect of this is that we need to provide resources and supports for parents to be fully engaged in supporting their children's mental health. This is something that schools can't do alone. For far too long, we've asked our teachers and our administrators to try to be everything to everybody. We need the entire community engaged in this conversation. And so as State Superintendent of Education, I'm going to be looking to put my bridge building experience to work to engage our faith community, our business community, and our parents in our schools to help support our students and meet them where they are in their mental health needs as well as their academic needs.
Ms. Ellis.
Mental health is something, an issue that teachers have been screaming into the void for years, well before COVID. What COVID showed us is that, hey, if we had listened to teachers all along, we could have been addressing these issues ahead of time. Mental health, that ratio is really sad, but it's what I see in our schools every day. I worked in a middle school where there was a mental health counselor on Tuesdays from 9 to 12 and then Thursdays from 12 to 3. And so, we as adults were like, well, I guess we can't have any issues on Wednesday. That's unacceptable for our students. I think that we have to address that. And sadly, again, it comes through funding. When you're underfunding, you're expecting your local districts to make up that difference. And those are the type of places that are roles that get swept under the rug because there's not enough to pay for them. I think we also need to recognize the professional capacity of mental health counselors and school psychologists and social workers and pay them what they're worth. And I think we also have to look at what we're expecting of students in a school setting. When we're dealing with high stakes testing and so much testing, that leads to testing anxiety, which leads to general anxiety, and it doesn't make for a positive experience. But right now, we've got students that are hurting for a number of different reasons, and those are society's problems that schools are having to address. And so you've got to give schools the resources and the funding to be able to do that.